This is continuing coverage of the World Healthcare Congress here in Washington, D.C. I'm Mabel Zhang. And in our studio right now, Dr. Vaughn Frigon, who is with the Tennessee Healthcare Finance and Administration. Dr. Frigon, thank you so much for being here.
Thank you.
And I just wanted to give our viewers a little bit of background. TennCare is the state of Tennessee's Medicaid program that currently provides health care for 1.6 million Tennesseans and operates with an annual budget of approximately $12 billion. And Dr. Frigon, I thought it was very interesting that you adjusted my numbers a little bit because there has been so much growth.
Yeah, we have seen some growth over the last several years. Part of that's related to the Affordable Care Act, and part of that is related to the changes in the economy. But we've had a significant increase in the number of individuals enrolled in our program.
Now, do you believe that reform within Medicaid is very important? Why is that?
I do. I think for a lot of reasons. Just generally, healthcare reform in our country is essential right now. That the costs of healthcare are out of control, and the outcomes that we're receiving are really not up to the amount of money that we're spending. So tremendous opportunity. But even more specific to the Medicaid program is Medicaid is the most vulnerable of our citizens. So of our 1.6 million people, about 2/3 of those are children, and the rest are pregnant women and disabled. So really an opportunity for that population to improve the quality of care, improve their outcomes, and do that in a way that's cost effective at the same time.
So what are some of the initiatives that are happening in your department now?
So about 4 years ago now, Governor Haslam, who's the governor of Tennessee, challenged the TennCare program, the state's Medicaid program, to lead an initiative statewide to transform the way healthcare is delivered and paid for. And since then, we have really started a process of changing the system that's taken a couple prongs. One is around primary care transformation. So we've developed a model called a patient-centered medical home, where every one of our TennCare enrollees is now assigned to a primary care doctor, and they know who that doctor is, and their doctor knows who they are. And there's a lot of studies that have shown that that's the optimal way to try to improve overall population health and wellness. And so that's one prong, is strengthening and reforming our primary care model. And the second is around acute episodes of care. So we've developed a process of about 40 episodes of acute interactions between providers and patients over the last 4 years. We started with a perinatal episode, total joint replacement, and asthma. And we've just reported within the 6 months our first results. And we're showing very positive signs in terms of improving quality of care, but also with cost effectiveness as well. So our quality metrics have all at least stayed stable or improved, and overall we've generated about $11 million in savings through the first year.
You've also focused on different conditions, like for instance, perinatal issues. Why was this of importance to you?
Right, so perinatal is births, and we cover in the TennCare program, the Medicaid program, about half the births in the state, right about 50%. So that's a big driver of cost and opportunity for us. So we started with that as one of our first episodes, and what we do with each one of these episodes is we bring in providers from across the state and talk about where are the opportunities to improve care. We start with what it looks like for a patient going through the journey of this particular condition. So for this episode, we talked about what does it look like for a woman from the time she's pregnant until her delivery, and then for 2 months afterwards. And where are the opportunities, where are the best practices that we can develop to try to improve quality and outcomes, but also to improve cost effectiveness as well. And so that was the first episode we implemented back in 2013. Our first year of financial accountability started on January 1 of 2015, and each accountability period goes for 1 year. So in 2016, we reported our first results. So the opportunities around perinatal, the birth, and then the neonatal, the first several months of life, are tremendous for the Medicaid program.
We're so pleased that you're able to share some of your findings in Tennessee. Why did you choose the World Healthcare Congress to present?
I think this is a great opportunity to get our message out about what we're doing in Tennessee to a broader audience. One of the things that's exciting about healthcare right now is that there's a lot of different experiments going on around reforming the system. Medicaid programs in many states are leading those initiatives, but a lot of other payers and provider groups and other organizations are looking at ways to improve healthcare, to improve the outcomes we're getting, and to improve cost effectiveness. And so to come to a meeting like this and be able to share what we're doing and learn from what other organizations are doing, we'll be able to take this back to Tennessee, and hopefully some of the lessons that we're learning in Tennessee can be spread more broadly. And I do think as we move through the next 5 years that the delivery of healthcare is going to look very different, and there's an opportunity for us to shape that in a way that's very positive.
Great. Dr. Frigon, thank you so much for your time today.
Great,
really appreciate it.
It's an honor.
And thank you so much for joining us. Stay tuned. We have much more to come.